So, today we're going to talk about a pretty fascinating medication, one that seems to have a split personality. It's called Selegiline, and this is the story of how one single drug can treat two totally different conditions, a movement disorder and a mood disorder. Let's get into it.
Yeah, that's the big question, right? How on earth does that work? How can the same chemical help with Parkinson's, which affects how you move, and also major depression, which affects how you feel? Well, it might seem kind of impossible, but the answer is all in the pharmacology. Let's break it down. Okay, so the drug is Selegiline. You might also hear it called by its older brand name, Deprenyl. On one hand, it's used to help manage the motor symptoms of Parkinson's. On the other hand, it's a really effective treatment for major depression. Now, to get how that's even possible, we need to meet the brain's tiny but super powerful recycling crew. You see, the whole story of Selegiline really comes down to how it interacts with this one specific group of enzymes. They're called monoamine oxidase, or just MAOs for short. And their job is, well, it's absolutely critical for keeping our entire brain chemistry in balance. The best way to think about MAOs is as the brain's cleanup crew. So after neurotransmitters, like dopamine, serotonin, and norepinephrine deliver their chemical messages between your brain cells, the MAOs come in, break them down, and get them ready for recycling. It's a vital process. But what if you wanted those messages to hang around just a little bit longer? And that right there is where Selegiline enters the picture. But here's the really important part. This recycling crew isn't just one big team. It's actually split into two specialists. You've got MAOA, which mostly focuses on serotonin and norepinephrine, the big players in your mood. And then you have MAO-B, which is pretty much the dopamine specialist. And dopamine, as you know, is central to movement and reward. This one little difference, it's the key to this whole puzzle. All right, let's look at Selegiline's first face. Its job in fighting Parkinson's disease. Now, since Parkinson's is at its core a disease caused by a lack of dopamine, you can probably guess which one of those two MAO enzymes we're going to want to target. And here it is, the first secret to its dual identity. It's all about the dose and selectivity. When you take Selegiline as a low-dose pill, it acts like a sniper. It goes in and specifically, selectively, takes out only the MAO-B enzyme, the one that recycles dopamine. It leaves MAOA almost completely alone. You gotta love how beautifully simple the logic is here. Selegiline blocks the enzyme that breaks down dopamine, so naturally that breakdown process slows way down. This means that the precious dopamine a Parkinson's patient has gets to stick around in the brain longer, doing more work. And the results? An improvement in motor control. And in the real world, the impact for patients can be a really big deal. It can help smooth out those incredibly frustrating on-off periods where it feels like the medication just stops working. It also works as a helper drug, making the main treatment, levodopa, last longer. Sometimes this can even delay the need to start levodopa, or at least allow patients to stay on lower doses. Okay, so that's the Parkinson story. It's a targeted strike on MAO-B to save dopamine. But what about depression? Well, to treat depression, you need to boost serotonin and norepinephrine, which means you have to block MAO-A too. So how does Selegiline pull that off without causing other issues? The answer, incredibly, isn't in the drug itself. It's in how you get it into your body. You see, the real game changer wasn't a new molecule. It was a totally new delivery system. The big breakthrough for using Selegiline to treat depression came in the form of a skin patch sold under the brand name MAO-B. And this simple change in how you take the drug, well, it changed everything. By putting the medication in a patch, it gets absorbed directly through the skin into the bloodstream. And here's the magic step. It completely bypasses the gut and the liver. This lets enough of the drug reach the brain to block both MAOA and MAO-B. So now you're not just saving dopamine, you're also boosting serotonin and norepinephrine, hitting the classic targets for an antidepressant. Okay, let's just quickly put this all together because it's super important. For Parkinson's, you have the standard oral tablet or capsule, which at low doses hones in on just MAO-B. There's also a disintegrating tablet, which can sometimes mean fewer stimulant side effects. And then, for major depression, you have the transdermal patch. Its huge advantage is that it bypasses the gut, letting it hit both MAOA and MAO-B in the brain, which is exactly what you need for that antidepressant effect. Now, it goes without saying, a drug this powerful and this versatile comes with some very important rules. I mean, because it's messing with the brain's fundamental recycling system, you have to be incredibly careful about what else you're putting into your body at the same time. Which brings us to a risk that made this whole class of drugs famous, or maybe infamous. I'm talking about the cheese reaction. It sounds a little weird, I know, but it represents a very real and potentially very serious danger. So here's what's going on. That MAOA enzyme, the serotonin and norepinephrine specialist, it doesn't just work in the brain. You also have a ton of it in your gut, and its job there is to break down a compound from food called tyramine. Now, if you block that gut enzyme and then you eat something high in tyramine, well, those tyramine levels can skyrocket, causing a massive, dangerous spike in blood pressure. That's a hypertensive crisis. And that's exactly why patients taking these kinds of drugs, including higher doses of the oral Selegiline, have to be on a really strict diet. We're talking about avoiding foods that are loaded with tyramine, like aged cheeses, think cheddar or blue cheese, cured meats like salami, soy sauce, and even some drinks like draft beer and red wine. And this right here is why that patch is so brilliant. Because that lowest dose patch bypasses the gut entirely. It leaves all those MAOA enzymes in your gut free to do their job and break down any tyramine you eat, and that means at that starting dose, no strict diet is needed. That is a massive improvement in quality of life. The other big one to watch out for is something called serotonin syndrome. This is what happens when you get way too much serotonin activity in your brain. Now, this isn't caused by food. It's caused by dangerous drug combinations. Mixing Selegiline with other drugs that also boost serotonin, like the really common SSRI antidepressants, is basically a recipe for a medical emergency. And I have to be really clear here, this is non-negotiable. Selegiline absolutely cannot be mixed with a whole list of other medications. This means other MAOIs, almost all modern antidepressants like SSRIs and SNRIs, the pain reliever tramadol, and even some simple over-the-counter decongestants. These interactions are incredibly serious, and it's why this medication always requires very close medical supervision. So look, if you take just one thing away from all this, let it be this simple idea. With Selegiline, the secret isn't just the chemical itself. It's that how you take it. The dose, the delivery system, completely changes what it does in your body. It's what turns it from a Parkinson's drug into a depression treatment. When you get right down to it, Selegiline really is a versatile and potent medication whose utility hinges on its unique pharmacology. It's just a perfect example of how truly understanding the nitty-gritty details of how a drug works can unlock brand new ways to use it. And that leaves us with a pretty cool final thought. The whole story of Selegiline was transformed by a simple patch. So it really makes you wonder, right? What other old, established, well-understood medications are just sitting out there, waiting for a similar clever innovation to unlock a whole second life we never even knew they had?